with yeast. So that's why you gotta look at the person if they have vaginal itching, especially at that age. See if there's any signs of atrophy. Maybe make sure you do a culture, just check for the other stuff. But I cannot tell you. And I probably did it in my first practice. I treated people for BV all the time because they had that vaginal irritation, but it was actually estrogen deficiency. So tuck that in the back of your heads, okay?
So what did you say you'd treat that with? Would you treat with like an estrogen?
Yep.
Okay.
Vaginal estrogen. Yep. Vaginal estradiol. Absolutely. That's right. So case study number 6. Jamie. 18-year-old female presents with abnormal vaginal discharge and irritation. She said she's had new partners in the last 4 months. They did not use a condom. What do you think is going on?
I would screen for the different types of STD, do a urine pregnancy, such as a gonorrhea, chlamydia, do trichomonas.
Okay. But definitely with the vaginal discharge and irritation, you want to do that. And chlamydia is probably the most prevalent. As a side note, as a practitioner does a lot of vaginitis on a daily basis. There's a couple new organisms out there that are very prevalent, especially in the younger populations. If you guys have heard of mycoplasma or Mycoplasma genitalium, or MGen, it's also called. You heard that? Anybody? Mm-hmm. If you have somebody that has that presents like this and has vaginal irritation, you're treating her for BV like crazy, just not getting better. You want to maybe do a more comprehensive swab because mycoplasma and ureaplasma are on the rise, especially with the younger population, and they need entirely different antibiotics to treat that. It's usually like something like doxycycline, but there's moxifloxacin we use Bactrim for a few different things, but there's cultures out there that can do the sensitivity and tell you what antibiotic to use. But I think you're going to see a lot of that in the future, but I think always just rule out the easy ones first. You're going to do the STD screen, and you're going to look for bacteria in yeast. Also not unusual for a woman with a new partner, if she's had several new partners, that it's not an STD, but it's upset in the vaginal flora. So I was taught that your vagina, because I was taught by midwives, is like a tropical rainforest. It's a bunch of different microorganisms, and if you upset that balance, there's an overgrowth of some of them, like Gardnerella, that causes the symptom. So having a new sexual partner, having a same-sex partner are all increased risk for bacterial vaginosis. So do you know, what would you treat for BV, do you know?
Hold on, I have it right here. Sorry. BV, isobestric. Where did I put it? I'm sorry.
Don't worry, no worries. You can pass if you want to. I don't have bacteria.
Can I interrupt real quick?
Yeah.
If you guys don't have this, it's like the EMRA 21st edition of Antibiotic Guide. It has like everything, GU, GI, like whatever, every system for like common infections and antibiotic treatment. So it's like $20-$30 on Amazon.
Cool. I have that too, and I use it a lot. Okay, I'm ready.
Okay.
Metronidazole. Am I saying it? Metronidazole. Okay, 500 milligrams BID for 7 days, or the gel intravaginally once for 5 days at 0.75%, or clindamycin cream. Yep, 2%. 5 grams intravaginally, bedtime for 7 days. Sorry. It was lost in my shuffle of paper.
Actually, and that's why I would encourage you guys in practice to do more intensive testing with bacterial, with vaginitis symptoms, because BV is probably more prevalent. It's more prevalent than yeast. And if you guys are sitting in primary care, one of the easiest things you can do is have a little thing of pH paper in your pocket. You just tear off some of the pH paper, and if that pH is 6.0 or more, it's either going to be bacterial vaginosis or atrophic vaginitis. Below that, if it's 4, you're going to know it's probably yeast.
So you said if it's greater than 6, it's probably BV or what else?
The atrophic vaginitis.
And less than 4 is probably trick. Or no, you said yeast.
Yep. So it's just one easy way to kind of give somebody immediate relief. Luke, how are you going to treat somebody with a yeast infection?
Like a fluconazole. I don't remember the exact dosage. It's just one. You take like one pill, and then in 72 hours you can take another pill if symptoms persist, I think.
Yeah, that's one way. Yeah. The standard is 1, but I always typically do 2 and just have them repeat it. Reassure them that they're not going to have immediate relief. It takes about 3 days to get the full effect anyway, but yeah. Very good. We're doing okay on time, looks like it. Mandy, how are you going to treat chlamydia these days? You're on mute. I can't hear you.
I said, let me turn back to my page. I'm actually a SANE nurse, so I do have a little bit of experience with this stuff. You're going to give a gram of azithromycin orally, or a 7-day course of doxy.
Okay.
You also can, I think it's really based on if you think they're going to be compliant or not. If you don't feel they'll be compliant with the doxy, then they say just to do a gram of azithromycin.
Okay, so what's happened in the last couple of years is there's a azithromycin resistance for a lot of chlamydia. So we're kind of backpedaling and going back to doxy is kind of the main plan for.
Yeah, and that was always what they said was our first line choice. But if they weren't going to be, I can't think of the word. If they're not going to do it, compliant. Thank you. Which is the one you can do a shot of Rocephin? That's gonorrhea, right?
Right. Okay.
I have a question. So you said preferred treatment for chlamydia now is doxy, just due to like azithromycin resistance. So for exam purposes, if you were to ask us treatment for chlamydia, like the book, has azithromycin first, then doxy, what would you want us to?
I would not do that to you. And if I did do that to you, you would make it debate. And I would, I think that's already been taken care of. So it's not a problem. Not a problem. Good question. Final case study, number 7, you have a pap smear, 421 neurofemal that reports atypical cells of undetermined significance, or ASCUS. Using the PAP guidelines, Angelo, what would you tell this woman? I can't hear you. I think you're on mute.
Sorry. For the ASCUS, I'm not super familiar. Let me try and get this up real quick. So for that, you could look for more of a presence of HPV. But beyond that, I haven't been able to really look too deep into that yet.
And that's fair. And I know this is a little bit early in the game. So, with the 24-year-old, we don't routinely test for HPV. We know that most causes are caused from the HPV, and that in a healthy 21-year-old with a robust immune system, they usually can clear it. So we just kind of keep an eye on that. If it's atypical cells, we just kind of follow them back in a year. So I would kind of take a look at that ASCCP tools that I gave you. The app is, I know it costs some money, but if you are going to be in primary care, that app I still use all the time. It kind of helps. There's like a ASCCP app you can have that you can download on your phones.
Is it just a buy once for that $14.99 and you have it forever? Is that like a monthly charge or yearly?
Forever.
Oh.
Yeah. And they update the guidelines, and so those are always changed. So it's a nice little tool to have. Not requiring you guys to buy it at all, but if you plan to do women's health, that'd be a good thing to look at. A lot easier than trying to look it up through UpToDate and sift through all that information, to be honest. So we don't test for HPV for a reason, because we found that the more we tested these women, the more biopsies we were doing, and the more lead procedures we were doing, we were increasing risk of preterm labor. And we used to think that once you had HPV, you always had HPV, but we found that that's not true anymore. That the majority of 20-year-olds can clear the virus on their own. But you still need to, if they have any atypical cells, which generally means just, I don't know what it is what the atypical cells is. You just want to follow them up again in a year. Fortunately, with cervical cancer is very slow growing. So it's usually the women that go several years without a pap smear, the ones that end up in trouble. So that I would follow her up. Same with low grade. That we can follow up the next year on a 21-year-old also. If somebody's reporting it, ask us an HPV positive. This is kind of, you haven't had a chance to really look at this stuff. Some women can still carry the HPV virus, and all of a sudden it kind of resurfaces. So HPV positive doesn't mean recent exposure all the time. So a lot of women get freaked out that all of a sudden they end up with a positive HPV pap. Who's next? Steph, I haven't really picked on you very much. So a mother brings her 16-year-old for a pap smear because she thinks she's sexually active. What are you going to reply to her?
Well, first of all, I'd like to just kind of go over the general guidelines of when you would inactivate the pap smear on the patient. Example, recommendation is 21 years unless there is a problem. I also would like to question the daughter with or without the mother there, because just because the mother knows everything, she doesn't always know everything. But
would there be any reason to do a pap on a 16-year-old even if she was sexually active?
Not necessarily, no.
Nope. You don't start till the 21. Now they're even thinking about changing it to 25, but for the purpose of this test is 21. But they're thinking about changing that. So yeah. So for having another whole week or two to prepare for it, you guys have done pretty well. Actually, I'm pretty impressed. So if you have any questions, I'll be around. Make sure on the quizzes, like I said, make sure you get the information and draw your answers from what's in your book. Okay, don't go if you just Google it. You're going to probably end up wrong answers.
I did have.
I can't hear you again. I think your mic's off. There you go.
Sorry. For the 45-year-old female that had a normal pap smears, now is reporting ascus and HPV positive, what was the answer to that? Do you refer her for a CULP or not? Yeah.
You would probably refer her for a CULP if she's HPV positive.
Okay. Just wanted to make sure I understood that. And then the other question I had, not fully related, but how does the HPV vaccine affect young women? Like most young women are going to be positive for HPV, right? If they get the vaccine, does that mitigate that, or does it just mitigate the risk of cancer? Does that make sense?
It mitigates the actual virus.
Okay.
So we don't see near the abnormal PAPs we used to, so it's supposed to mitigate the virus there's about 50 different strains though, and the ones that the 20-year-olds right now you're seeing, or 30-year-olds just have the 16, 18, and 45, and I can't remember what the other one was for genital warts, but currently kids get the 9-valent vaccine, but there's like 50 different strains, so they still can get a strain of HPV. And the vaccine only gets the high-risk ones. Okay?
Thank you.
All right, you guys look just like you're about ready to pass out, so I'm going to not bore you any further, put you to sleep. We'll reconvene in a few weeks. Just know that there's a quick turnaround time for the second exam. It's like just 2 weeks after the first exam, because it's just OB. Okay? Questions? Anybody have any questions on any of the course stuff or anything?
Sorry, I just saw your email about this weekend. I guess, is Tuesday okay, since I'll be gone? I won't fly back until like midnight on Sunday.
Yeah, you just tell me what he's protecting our thank you for your service.
Yeah.
All right, guys. Well, study hard. You got to study. I mean, if you don't read the material, you probably won't do as well. And the first test is a little bit more difficult because you haven't been exposed to the content a lot in clinic. So I think you'll find it gets a little bit easier with time. But if you have any questions about anything on the exam, I want to make sure the exam is closed before I answer any questions. I'd be happy to meet with any of you guys. If you have any questions, you can email me. I just want to make sure you're comfortable with the content, okay?
Thank you.
All right, guys, have a good night, and we'll see you next time.
Thank you, you too.
Bye-bye.